Good afternoon and welcome to today's webinar, an overview of sustainability and resilience in the community, Part 1, Foodways and Healthcare. I'm Matt Reese, GreenGov Council Assistant Director. Today's webinar is co-hosted and supported through our partnership with the Penn State Sustainability Institute. The GreenGov Council was established by Governor's Executive Order 2019-01, which requires Commonwealth agencies to lead by example, promoting energy conservation and sustainable governance. The executive order sets goals for the Commonwealth, including the goal of achieving 26% reduction of greenhouse gas emissions by 2025 and an 80% reduction by 2050. The executive order created specific goals for agencies on fleet electrification, high performance buildings, annual energy reductions, and the use of renewable electricity. You can visit our website at dgs.pa.gov/greengov to see how agencies are meeting these goals. You'll find a host of information on the website, including completed agency certification checklists, past annual reports, as well as a new annual report that's about to be released within the next week, GreenGov news and sign-up opportunities such as the GreenGov quarterly newsletter and future webinar series such as the one today. Now I'd like to introduce our friend, colleague, and partner at the Penn State Sustainability Institute, Peter Boger, PhD. Peter is Assistant Director of Community Engagement at Penn State University Sustainability Institute and is responsible for developing strategic programming and partnerships such as this one with the GreenGov Council that help Penn State leverage its resources to promote sustainability throughout the Commonwealth of Pennsylvania. Go ahead, Peter.
Thank you so much, Matt, and thank you everybody for joining us today. As always, we are super excited to be in this partnership with the GreenGov Council. The Sustainability Institute at Penn State has a very similar mission to the GreenGov Council in the same way that Matt and Mark and the Council are not the owners of sustainability for the state of Pennsylvania, but are in fact helping to facilitate it across the entire Commonwealth government. Penn State Sustainability Institute does not own sustainability for the Penn State system, but our mission is to help facilitate and integrate that across Penn State's 24 campuses in teaching, research, outreach, student engagement, and operations. And so with these similar missions, this kind of partnership where we can bring people together in community, start thinking about the big intersecting ideas of sustainability and thinking about how we can create novel partnerships and learn from each other across the Commonwealth is a really exciting opportunity. And especially with our topic today, we've been thinking a lot in this webinar series throughout the year about climate change and about resilience in communities. And now we're broadening out the idea of resilience and what we're talking about today in terms of foodways, health, and community resilience. And I'm super excited to be introducing our speaker today. I had the great good fortune to feature her at a previous series a couple years ago. And when we started talking through ideas for who could we bring and what kinds of novel programs we could talk about, it's like, I know the person. She excited everybody when we heard her before, and I know she's going to excite all of you today. So our speaker today is Maureen Krause, who has her master's in public health and is a master's certified health education specialist. She is the manager of the Lankenau Medical Center Community Health and Outreach Department, which includes the hospital's Health Education Center, Community Outreach, and the Deaver Wellness Farm. Maureen has over 30 years of experience in public health education at Lankenau, including teaching health education to children and adults, screenings, and helping navigate the hospital's programs to help with food insecurity in the surrounding community. And when she has some free time, she and her family are tackling the national parks and have visited 32 of the 63. So we are super delighted to have Maureen, and I'm excited to hear her talk today, and I will turn it over to you.
All right. Peter, thank you for that introduction, and thank you for inviting me to speak, that you remembered me, because it was a few years ago. I think it may have been before COVID. I don't even know at this stage. But all right, let me share my screen, everyone. Thank you. Good afternoon to everyone. I am going to share a window. All right. If you don't see that, let me know. All right. So when Peter asked me to speak, and what we talked about before, the unique thing about, I am based at a hospital. I am physically, and I'll give you a little information about it. It's Lankenau Medical Center. We are, you'll see in a minute, located right outside of the city of Philadelphia. And then we have a history of fighting food insecurity because we know that link between nutrition and chronic diseases and health. I can talk a little bit about our COVID response because COVID brought and highlighted the food insecurity, the availability of food and produce, and to the, especially to the city area, our food insecurity programs, and why we're here today. So just to give you a little All right, that's our farm. It's a little unusual, but if you go with the background of Lankenau, we were established in 1860. We are actually built on a golf course. So we have 93 acres, which is awesome. And we want to make use of those 93 acres. So with township restrictions, we're restricted on where we can build. So we had a lot of extra grass, green land, which is awesome. So we formed a nature trail. So our employees and our community can go out onto our walking trail. But then we also built a farm, which we'll talk about. Lankenau is part of a 5-hospital system called the Mainline Health System. We're a teaching hospital, which plays directly into our whole food sustainability outreach that we have. And we have 2,400 births, employees, about 2,500 births actually this year, and lots of discharges and emergency visits. But to give you an idea of what we do and why we're doing it, I think you need to understand more the demographics of Lankenau. We sit right here. This area here is called Montgomery County. All right, for those of you familiar with the southeastern Pennsylvania, this is all the city of Philadelphia, and this is Delaware County. If you notice, just based on the income, we are probably in about most of our residents, where the hospital is based in Wynwood, average about $75,000 to $100,000 in their annual household income. All right, as does up here, Bryn Mawr, our sister hospital. Our hospital down here is a little less, but still well over that. But we sit right on the intersection. It literally is Route 1, that it's called City Avenue, that divides us, and we drop. And our patient population is coming from there. And as you can see, we have areas that are under $25,000 of household income and average probably about $25,000 to $50,000. So there's definitely a distinctive difference between what is available and what is able to be done. Another geographic and interesting distinction is this is from the it's the Pennsylvania Hospital Health Survey, but it's also from this stats that you get from Robert Wood Johnson. As far as health and unhealthy populations, Philadelphia is ranked 67th. The city of Philadelphia is 67th out of 67 counties in the state of Pennsylvania. Montgomery County, for their health outcomes, is ranked 4th. So that shows you the difference right there. And we're literally right on the border. And Delaware County, which we sit on the other border of, is 22nd. So we have a very, very diverse population that we're working with and that we're dealing with. If we go into the health factors, and again, it's all about your zip code and your genetic code. Again, Philadelphia is ranking 67th in the health factors, and that includes health behaviors, clinical care access to this, social environmental factors, physical environment, your air quality, your housing. So some of it is not surprising. Community safety, family social support, income, employment, education, length of life and quality of life. Montgomery County is first in it, and Delaware County is 11th. We are right there at that blue X. I couldn't make it any bigger, but there it is. And this is Philadelphia right here, Delaware County, Montgomery County. So what we see, what we experience in our population is dramatic. It is dramatic. So we had to figure out how do we reach the population that we serve to make them healthier. We were experiencing a lot of what you may want to call frequent flyers to our emergency room. But the reason that they had to come to the emergency room is their access to health care. But then as you go into the root causes, it's more of their access to electricity, access to healthy food. Okay, either they couldn't afford it or it's not in their area. So Lankenau made decision a while ago, all right, to get to that intersection between health and food. One, we know nutrition impacts all of health. Okay, everything they do impacts it. It has a direct impact to chronic diseases, diabetes, cancers, heart disease, all of which we are dealing with right now. So what we did was initially probably about, I want to say in 2012, it might have been a little bit before, we began investing in coupons to local farmers markets. We formed a partnership with the Food Trust, which you might be familiar with, who sponsors farmers markets in the city of Philadelphia. Well, in a PHMC survey, we found out that participants living in Philly, only 25% of them rate the quality of grocery stores fair or poor. Okay. There are fewer grocery stores, and there are lots and lots of corner stores. And if you're familiar with the corner stores in Philadelphia, they do not necessarily have the best selection nor the healthiest. And many of them, I would say the majority, minus those that are considered a healthy corner store, have even fresh fruit or fresh vegetables. So the other thing, 25 reduced the size of their meals based on cost of what they're serving, and another 58% of our participants had difficulty making monthly household payments. So we invested with Food Trust, and we bought into their Philly Food Bucks. Philly Food Bucks were used that we could give to a patient who was having nutritional issues, nutritional needs. They screened under the hunger vital signs, and we would give them up to $10 in coupons that they could be used at local farmers markets to go. Now, the farmers markets were only in the city, and many of them had to take buses to get there, transportation to get there. So it wasn't always convenient for them, and we found that in the redemption rates. So as time went on and we're trying to reach out more to the population, they're coming basically from 3 teaching practices. We're a teaching hospital here, and we have 3 resident teaching practices, and they serve an underinsured, uninsured, or a lower socioeconomic population. So they definitely would have the needs. So working through the food, coupons, things like that, we came up with another idea. This is Lankenau, okay? That other picture didn't kind of show it. So we have that 93 acres of land. And in 2014, our president at the time, in an effort to combat the food insecurity that our patients faced, he proposed establishing a half-acre organic farm. We had to call it a garden at the time due to township restrictions to get it approved. Long story there, but okay, we won't go into it. We've since changed it to the Wellness Farm. And here it is. It has what we call production beds, which is here. They happen to be hoop covered right now. And then we have our greenhouse. We have a gazebo. And then over in this area is a student or education garden. We received funding from the Dilemma G. Deaver Fund, which has to be used for education. It also funds the Health Education Center that I manage. And so our mission was to connect students coming from our whole surrounding area, and the majority do come from the city of Philadelphia, to the source of healthy food, to promote healthy eating, and to investigate the science behind the agricultural. So that's why we have this whole education garden down there. All in all, between the Health Education Center and the farm, we probably see, well, we used to, before COVID, about 10,000 students a year. We now do virtual classes, but we just got the word that coming in April, we can have in-person classes again, which we're very excited about that. So we had the farm, our hospital president, he was phenomenal. I will give a shout out to him because he was actually recognized by Michelle Obama because he said that if the White House can build a garden, why can't we? And when she did the groundbreaking for the garden that they used to have at the White House, she actually quoted him as a president of a hospital from outside of Philadelphia. So that was very exciting for us. So this is our farm. And this is what it looks like with the kids there. Okay. It has been endowed, so it will be with us, which is nice, and it's not affecting the hospital budget. because it's tight times right now for healthcare. These are students just being very inquisitive. Well, the wonderful thing about the farm, and something we really didn't plan on, we didn't think it through, is we had in our first season, we produced, which was 2016, a bountiful of produce. And then all of a sudden we had an issue. What do we do with this produce? So what we did was we went to the resident teaching practices and provided the patients with bags of fresh produce free of charge. And we would do a little pop-up nutrition lecture to go along with it. And I don't want to call it a lecture, but we incorporated recipes for the crops and nutrition education, emphasizing the importance of eating fresh, as close to the farm as possible. To date, we've harvested over 28,000 pounds of food, 41 varieties of crops, and it all goes to our patients. So how did we do this? We had market days with fresh produce, meaning the farmers would harvest the produce, let's say Monday, Tuesday, get it all ready. Wednesday, it would be up in the physician practices. So anybody luckily getting an appointment on a Wednesday could go home with a bag of food, and they got to pick what they wanted. We had our nutrition pop-ups with education and produce in the waiting rooms. Okay, that was on another day. That's myself and my colleague, Helen. We are teaching this group. We had recipes that we provided them with, but we always started out with, why do you think Lankenau is doing this? To try to get them to understand that we want them to eat healthy, to try to get them to understand that we want them to eat fresh as possible, and get away from the processed foods. And then the other thing we would tell them very nicely is, we are giving you this free of charge to try it on Lankenau's dime. It's not costing them anything. So see if you like eggplant. If you don't like eggplant, okay, fine, then don't buy it when you go to the ShopRite, Acme, Wegmans, wherever you happen to be shopping. But if we can introduce them to new varieties and new types of food, that was one of our goals too. And then we also were able to do cooking demonstrations. They got to taste recipes. I will tell you, our cooking demonstrations, only because of fire regulations and township regulations, weren't anything hot. It wasn't anything hot unless we did it in a microwave, and we were trying to get away from that. So we did fresh. We did lots and lots of salads, and we showed them how to do salads, eating the greens, mixing them together. We could use a blender, so we did an arugula pesto, and they were able to try that. So, and then they could go home with the recipe and that vegetable. Which was very, very happy. They were happy about that. Then COVID hit, and we all know about it. Problem is, COVID didn't hit the farm. We still had, just between May to November of 2020, 5,400 pounds, okay, of food. 5,418, all right, 1,000 pounds of food that we had to do. So what do? Well, we did a lot of telehealth then, and we realized that they were still experiencing, in fact, more patients were experiencing food insecurities. So we partnered with a local agency here called Food Connect to deliver food, to bags of food, this is just a little sampling down there, to the patients' homes. We averaged 26 patients a week. Okay, they had to agree to participate in the home delivery. They were referred to from either our care management social work program or our home care, or through our emergency room social worker. During that season, we had 600 home deliveries for the program. Each week averaged about 5 pounds of fresh produce, okay, with an estimated 3,500 pounds of produce being delivered to the patients between May and November. The other 2,000 pounds actually went to our own healthcare workers. The farm would call me, I would set up a station as they were leaving at 7 o'clock at night, whatever. And the smiles on their faces after dealing with what they had been dealing with for that very height back then, the beginning of COVID, when we didn't know much about the coronavirus. So moving forward, March 2020, COVID-19 is still there. We didn't think it would be, but it is. But the USDA, I'm sorry, in March of 2020, go backwards, we're still in 2020. The USDA approached us, and with the help with Common Market, okay, who we have a very, very strong relationship with and partnership with, they asked us if we would distribute the produce boxes that were part of the USDA farm to family programs. So we had 140 fresh produce boxes delivered weekly to Lankenau. 70 went to our home care patients and oncology patients. Another 70 went to community members, residents on SNAP benefits for the lower socioeconomic housing areas, and also to a community church for families facing food insecurities. Here is, the boxes were donated. They were free of charge. We paid for the delivery with some grants that we received. Here you have, these are two guys picking them up. They loaded the boxes in the back of their car, and this is one of our community health workers, Evelyn, who was working with them. This is actually the shed at the down at the farm. But as you can see, we're doing everything we can, and our key was getting it right as fresh as possible to our patients. Now, the 2021 season. Okay, a little bit of a different outlook. The home deliveries for the Deaver Farm produce still continued because we were not having the volume of patients in the waiting room. Plus, we changed the whole waiting room procedure where they would come in, they might wait less than 2 minutes and get brought right back to their rooms. Plus, we were not allowed to go down and be exposed as far as employees. So we continued with the home delivery. We screened the patients by case managers or social workers for food insecurity using the hunger vital signs. We had 34 to 40 unique patients, okay? 27 weeks of deliveries, 918 deliveries to 14 different zip codes, most of them in the city of Philadelphia. Each was given 5 to 6 pounds of fresh produce delivered, and we did it bi-weekly. One of the feedbacks from the 2020 program was it was too much food. If it was just a single person and we didn't know the patients and their family background, whatever, some of them it was too much food for. So we cut it to a bi-weekly. We included recipes, tip sheets, and an identification sheet. This is the identification sheet. So that week they got cherry tomatoes, hot tomatoes, sweet peppers, and it looks like Chinese cabbage. I can't read the name of it. So, but we, as I said, we have 41 different varieties of food, and we have recipes and tip sheets for each. Along with the home delivery, we still had extra produce. So we went back with the permission of our infection prevention department. We were able to actually bag food, put it in a green bag, okay, and then give it out to the patient in the doctor's office. So we went back to the patient practices, and then we had bagged foods there. This happens to be the Chinese cabbage, all right? So they get general information about it, health benefits, storing, preparation, and use, and on the back of it is a recipe for them to use. Just an idea, so this is what it would look like. This is our bagged produce, and they would just, you know, are you interested in a bag? Some of them by the end said, well, what's in it? So that's why we had our what's in the bag. They can get picky with what they want. They don't always like to change or anything like that. But 708 patients took home fresh produce, storage tips, and it was right from the garden. Grant funding allowed us to continue to purchase 75 boxes from locally grown produce from the Common Market. We did bi-weekly home deliveries, reaching 159 unique patients from 36 different zip codes. Each one of those boxes, along with, they probably got, it was, I can tell you, it's a $15 box and it's about 12 pounds worth of food. Varies, it does have a little bit more fruit than what our farm is able to produce. And they were given some sort of an education sheet. This happens to be our adding fiber to your diet, but there was hydration, herbs for cooking, salt substitutes, all kinds of things like that. Where does that bring us? Where do we go from here? All right. To continue, we want to continue to address the food insecurities and the link between nutrition and medicine. Okay. 2022, we've increased the food box purchase from the common market. And we've upped it to 160 patients biweekly. Again, these patients are screened with the hunger vital signs. We've extended the program through November. The program, as far as the food delivery program for the common market boxes, that ended in September, the very first week of September last year, because this is based on funding that we are getting from our Lankenau Foundation grant. So but we were able to go back to them and see if we could extend it, and we are able to extend it through November. So that will coincide also with our healthy produce that comes from our farm. That will be from June until November. We will continue with the home deliveries from the farm. We will continue with the market pop-ups and the practices with the goal of just expanding to different practices. And our goal actually, and I have a conversation next week, no, 2 weeks about it on the 25th, expanding the Deaver Wellness Farm. It has been very, very successful. I do have some more information that actually I just got. What we did, we have a research center, Lankenau Institute for Medical Research, and under that comes our Population Health Center. And they did a survey for us all during the 2021 spring season and summer season. And we got the survey results. Nutrition is important to everyone. Okay, most people that we gave the food to have to shop in supermarkets. All right, so they're not close to farmers markets or things like that. And the biggest issue for them to eat healthy was cost and price, which none of that is surprising. Another barrier was transportation. 50% of them were definitely screened positive with the hunger vital signs. I will tell you 10 of the people that we surveyed were also pregnant young females from our OBGYN practice, and they were experiencing gestational hypertension. So we were trying to see if giving them fresh fruits and vegetables, one, would change their behavior, and two, might help their hypertensive crisis that they could have while pregnant. Interesting thing about the recipes is that they liked the recipes, but they didn't use the recipes because they either had a health restriction, which could be anything, because we have a lot of greens. We come from a farm, we raise things on a farm. So all of those greens, if you're taking a blood thinner, they're not going to be able to use them. So all of this has to go into our planning of what they can do. You can use them in moderation, but we have to rethink our recipes. The other thing is which we found was sometimes 37% did not use some of the food because they just didn't like what it looked like, and they weren't familiar with it. So we've been having conversations with our farmer. For one is arugula was a big one, and the Chinese cabbage. It's just not something that they see regularly on a market. And as much as we want to open their horizons and widen their horizons, we might need to also do that and make sure we always have something that they're familiar with. The carrots, the cucumbers, tomatoes, they're always the most popular. The beans, eggplant we're getting there on that one. So we have to watch what we are actually raising and growing on the farm. Most of the people cooked it, okay, as opposed to eating it raw. But of the 100% wanted more or wanted to continue with the food deliveries, and 75% that it did say that it did help them meet their food and nutritional needs. One additional benefit of the farm, which actually it's big in healthcare. Hold on, why is this not? There we go. Is we are a teaching hospital. We have residents coming from medical schools all over the country. So what we were able to create was a 2-week resident elective. So these students can take 2 weeks and work on the farm. Here is one of them doing some harvesting there. Looks like we have some kale, some scallions, some radishes, cucumbers, beans, I think, or maybe there's zucchini, I'm not sure. along with actually understanding nature, what it takes to, raise it, how it goes from that seed, to into your mouth, that whole farm to table aspect. It also gave them a way to connect with their patients. We have them call the patients that are receiving the food just to see, did you receive it? How do you feel about it? What's going on? Did you use anything? And then it gave them a better understanding of the connection between food and, nutrition and wellness. Because I will tell you one thing about medical school is you do not get a nutrition class. And it's so important that they understand a little bit more about that nutrition. What we have found that it does is these residents are the same residents who are working in the practice where we have the green bags that the patients can go home with. So they actually can, if they see a green bag when they walk into an exam room, they can talk to the patient about that connection between nutrition and wellness and the importance of eating, the fresher, the better. So just a couple more. We did get from Common Market their certificate of support for sourcing nutritious foods. That's about what we did for 2021 as far as how much we invested in our community. 20,000 pounds of food, which is a lot. And then just to end, just a few pictures of our farm. This is one of my favorites. It's after a snowstorm. It's just so peaceful. But then we have it. We're back ready to go. We have our new, it's raised bed farming. We have our new beds that we had to do. We did them the end of last year. I want to say like in November, they were building them. They're filled, ready to go. And then we have them starting seeds and everything here. That woman back there is our farmer who doesn't like to be on camera. So that is the end of what I have and how Lankenau is trying to meet that food sustainability and also still deal with healthcare and nutrition insecurity that we have, that we find in our community, all around us. I should say of the zip codes, they're not all from Philadelphia. So it's from Delaware County and Montgomery County. So I can leave that up. Peter, is there any questions or anything? How do we want to work this?
Okay, and thank you. Looks like we'll stop the recording now and then get started with a question and answer session.
I'm sorry.